Hello everyone, I'm Sakshi and I welcome you all to this video podcast series Wellness Wisdom, which is presented to you by Chitkara School of Mass Communication in collaboration with Chitkara Healthcare Management. This is a podcast where we simplify the concepts of mental health and well-being to help you navigate the complexities of modern life. Whether you are a caregiver or a healthcare professional, this podcast is for you. Today in this journey, we are joined by Dr. Jayashree Dasgupta, a therapist and a clinical researcher specializing in brain health and dementia care. Her work focuses on creating awareness about mental health conditions, particularly in older age, and developing innovative solutions to support active aging and dementia. Dr. Jayashree is passionate about integrating creative practices in health interventions, providing solutions which empower individuals and caregivers to navigate through the challenges. I welcome you, Dr. Jayashree. It's indeed an honor to have you amongst us.
Thank you, Sakshi. It's wonderful to speak with you today.
Yeah. So, Dr. Jayashree, my first question to you is, what is brain health?
Brain health is it's an emerging concept. It's a very new way of thinking about an organ that's very critical for our entire being and functioning. As everyone is well aware, the brain is the central powerhouse of an individual, and brain health encompasses everything that's related to your cognitive well-being, your social well-being, your emotional well-being. It also encompasses how your physical health is, and it talks about the entire complex environment around us and how that influences the brain functioning. A key aspect of brain health is optimizing brain functioning. So it's about how we can optimize our brain's potential to help us to adapt to challenges in the environment, help us deal with difficult circumstances. And it's not just about the presence or absence of an illness or a disease.
Okay. So we see a lot of people are talking about mental health these days. So is mental health and brain health same?
So brain health it's a broader term. Mental health, when we talk about mental health, usually people associate this with the mental health illnesses or conditions such as depression, anxiety. There's a host of mental health related disorders that we're focusing on. Brain health is a broader term, and it focuses on the entire being, the interactions with the environment, and thinking about how we can optimize the functioning of the brain. So brain health is a broader term than mental health, and mental health is a part of it. It comes within that.
So nowadays there's a lot of emphasis on brain health all of a sudden. Why is it so?
I think now people are recognizing that that the brain is so important for everything. I think up till now there was a lot of emphasis on understanding how important the heart is and how critical that it is for us. Over the past decades, we've seen a lot of changes in the way that people are becoming more aware about the importance of heart health, because we've seen changes in people. I mean, just today, in fact, there was a lot of coverage on how India has over 440 million people who are suffering from obesity.
Yeah.
And this is a huge challenge.
Yes,
it's obviously going to impact people's heart health.
Yeah.
But what people are not yet realizing, that it's not just the heart which is getting impacted. Any physical condition which the body experiences is ultimately going to impact your brain, because that's where that's what you're using to deal with every challenge, everything that you're experiencing in life. So brain health is a very broad concept. It's something that people are now focusing on to create more awareness about why it's important to take care of this organ that's actually directing our entire being.
Yes. Also, please throw some light on dementia. What is dementia? Mostly people are not aware of it. So what is dementia?
So dementia is a neurodegenerative condition. It's a disorder of the brain where there's a gradual loss in cognitive functioning. And by cognitive functioning, we mean things such as memory, attention, your ability to take socially appropriate decisions, plan things. So anything that's related to do with thinking gradually gets impacted, because that's the main role and function of the brain. And as a result of that, in dementia, what happens is that gradually the individual who has dementia becomes more and more dependent for everything. It is a neurodegenerative, means that there is a downhill course. We don't have a cure for dementia right now, but essentially the individual becomes dependent for all their basic needs. So they become dependent for basic things like feeding, bathing, toileting. They're not able to manage themselves.
So they're dependent for their daily ablutions, like everything?
Yes. So there are different stages in dementia. In the early stages of dementia, a person may just have difficulties with something like memory. So one of the early signs is that they may appear as though they're forgetting things. They may appear a little confused in the early stages, and then gradually they become more and more dependent for everything. So we see initially somebody, for example, who might have been managing all their financial decisions for a very long period of time, they're no longer able to manage such complex thought processes and decision making and all. Gradually that same individual, as the condition deteriorates further, becomes dependent for all the basic functions as well.
Okay. So dementia is often confused with Alzheimer's also. So are these two same?
So Alzheimer's is the most common form of dementia. Dementia is really an umbrella term for neurodegenerative disorders, and Alzheimer's disease accounts for almost 75% of the dementias. So therefore a lot of people think that Alzheimer's is synonymous with dementia. But the underlying pathologies of these different dementias, so what basically contributes to these deficits that we see, is different.
So are the symptoms for the two same, or they are different symptoms?
So for example, there are many different types of dementia. The most common is Alzheimer's that we were just mentioning. Another form is frontotemporal dementia. The most common symptom in Alzheimer's disease is a loss of memory functioning, and that's why people usually say that people mostly think that memory loss is the hallmark symptom of dementia. It's a hallmark feature of Alzheimer's. But in frontotemporal dementia, usually you see a lot of change in personality. So, for example, somebody may become there may be abusive behavior, they may start acting very erratic. You see almost some changes in that whole personality this person didn't exhibit before. Someone who's previously calm may become more change completely. And then of course there are some reversible dementias as well, which are, so for example, vitamin B12 dementia. That's something which occurs when there is a deficiency in the body from vitamin B12, and unlike the other dementias, giving supplements can help improve and restore a person's cognitive functioning.
So the only reason for this dementia is lack of vitamin B12 in the body?
It's a very specific type, type. The other forms of dementia, unfortunately, are neurodegenerative. So, and the reason why I mention that is because it's just important to know that if you're experiencing certain changes in your cognitive functioning, or you notice this in somebody, it's really important to think about how, get some basic test and meet a professional who can advise you further.
But we usually confuse it that older people have this problem of forgetting things, or being forgetful. So how to actually differentiate? That's the big question. How to differentiate whether an elderly person is actually suffering from dementia, or he or she is just forgetful because of the age?
And this is actually a huge challenge, because it's very difficult for loved ones, close family members to notice these changes. One of the things that's really important to understand is these differences though. And for example, when you're becoming forgetful, what are you becoming forgetful of? So for example, a lot of people forget names. I'm sure this is something that you and I have also done before. And you may be somebody who just struggles with remembering names. That doesn't mean you're getting dementia. In dementia, the difference is that somebody forgets names of loved ones or people whom they meet with frequently.
Okay.
If you're forgetting names of someone who you hardly meet, or you just met recently, that's not a sign of dementia. People with dementia forget the names of their close ones, their children, their family members, their spouse, and then they, as the condition deteriorates, they fail to recognize them.
Yeah, right.
Another hallmark feature is when they get lost in familiar places.
Right.
So that's another hallmark feature. They become very disorganized and they're not really bothered about it. So, sometimes in old age we say it's okay that, people will make, it seems like an excuse, and we also say it's okay,
we say that's
I'm tired.
It's
part of it.
Yeah. It's part of aging.
Yeah, like I'm not feeling like doing this, and that's okay. But when there's a point when they stop caring about it, and that's something that family members should begin to get concerned about, because it could be an underlying dementia process.
Is dementia a genetic disorder?
Well, there's definitely a genetic component, but it's also impacted hugely by the environment and other factors as well. So there are several genes that are involved with in dementia, and specifically when we talk about Alzheimer's, which is the most common, there's a gene called the apolipo4 allele, and if a person has, so it increases your risk for dementia. It's inherited, so like if you inherit one copy of the gene, it can increase your risk of dementia up to 2 to 3 times. If you inherit 2 copies of this gene from both your parents, it can actually increase your risk between 8 to 12 times. So that seems quite significant. But having said that, not everybody who has this develops dementia, because there are several things that influence it, from your early life experiences as well as from the environment as well.
So how many people actually get affected by dementia? What's the percentage like?
So if we were to talk about just India, currently there are projections which indicate that there are about 8.8 million people who are living with dementia. That's a huge number. And these are actually projections from the longitudinal aging study in India. And these are all self-report. Which actually means that it's possible there are even higher numbers there, because it's quite undiagnosed.
So this is a reported number, so we really don't know how many other people are suffering from it.
Absolutely, because there's very little awareness, and as we were discussing, it's not easy to distinguish the early signs of dementia from a natural aging process. So there may be people who don't even recognize that it is dementia.
Right. So in India, how much awareness is there till now? Because most of the people, they have no idea about dementia or Alzheimer's. That's just a fancy name used in English movies. So how much awareness is there right now? Like, what are the steps taken to create awareness, or what are the steps should be taken to create awareness?
That's a really important aspect that we've been working towards, because there's research data to show that only 1 in 10 people actually get any sort of support for dementia. So there's almost a 90% treatment gap. That means majority of people who are living with dementia are actually not getting any sort of diagnosis or professional support at all, and that's huge.
Yeah, that's a huge number.
It's a huge number, especially when you're caring for somebody who's essentially becoming dependent. So the first thing is really becoming aware about the early signs and symptoms. And I think the second important thing is breaking the stigma that we have about seeking help, and approaching a professional to just get clarification on whether this is something I should be concerned about or not. A lot of times I see family members who are just very reluctant to go and approach a mental health professional, a neurologist or a psychiatrist, because there's so much stigma.
See, in India, depression is a stigma. It's not a topic which most people are comfortable talking about. So the first and foremost thing is to create awareness that it is a mental state which anyone can have. So that's the first thing that I think. And how many people are actually suffering from it, and they are not reporting it because of the stigma attached to it. So in India, do we have some special help units for people who are suffering from dementia?
Unfortunately, very little is going on. Much more needs to be done.
Okay.
There are certain states in India which are recognizing that it is important to address brain health. So if we only look at it from an illness perspective, the problem there is that you're dealing with the problem once it's happened. I think a better approach is to say, what can we do to prevent that problem? So there are a lot of, it's kind of when we talk about brain health and dementia, it's important to see what we can do to prevent this in the first place. But we don't have a national dementia plan, for example. We don't have enough trained professionals to even diagnose and provide the kind of support that people who are living with dementia require. Most of these people, majority, are cared for by their family members, and dementia places a huge toll on family members.
And the family members are also self-trained. They have no training and knowledge about it.
Absolutely. They don't have any knowledge about it. They don't know where to get access to this knowledge. I mean, most of the time, just to give you an example, we've done some research to understand the challenges that caregivers are facing. And we found that most of the caregivers are quite naturally, they're women. And a lot of them, particularly in the metro areas and urban regions, they're actually women who are in their middle age who've had to give up, career prospects, give up other personal aspects of their lives to then care for an aging parent or a mother-in-law, father-in-law, some other relative in the family, and it puts a huge pressure on them. Whilst they're also caring for and raising, children. So they're like sandwiched in the middle.
And they're navigating through the life, right? So in Tier 1 and Tier 2 cities, there might be some awareness, but in Tier 3 cities, there is no awareness at all. So what are the simple things that you can suggest to differentiate between old age forgetfulness and dementia? Just few 3-4 pointers that our audience can have.
I think when we're talking about Tier 3 cities, usually what we see is that there's a lot of community, sense of community, and that's a fantastic protective factor, in fact, because social isolation and depression together, they account for an increase in the risk for dementia up to 8%.
Okay.
And I think that's actually, in the Tier 3 cities, the fact that there is this great sense of community in India is wonderful.
They are so connected.
They're really connected, and people watch out for each other.
Right.
So I think one thing that's really important is that if there's somebody who's normally part of, very active, involved, you notice that they're beginning to become withdrawn. That should alert people.
Right.
Because it might be that they're experiencing some embarrassment. They may be initial stages of dementia. People are able to mask. We call it masking. They're able to hide the difficulties they're facing. So if they're having a memory issue, they're able to cover it up. They just joke about it. Oh, I forgot this. I'm aging, and we also take it very lightly.
Very casually. Right?
Very casually. But if they begin to kind of withdraw, then that should really be a red flag. And of course, close family members, if they notice any changes in the routine and the behavior, then that is again a red flag. Changes in personal hygiene, for example, not wanting to bathe, do things that they used to do, puja part, which they used to do regularly. They just show a disinterest in that.
So their normal life is disturbed.
It's just an early small change, something that's different from what they used to do routinely.
So is there any cure for dementia?
I wish I could say yes, but unfortunately
there is no cure.
There is no cure. And this is despite a lot of research that's been going on for several decades. Sadly, we don't have any cure for dementia. However, there are a lot of research studies that are going on to see what drugs can be developed to slow the progression of this condition, but it's very much at research stage, and currently in India we definitely do not have anything that is accessible and affordable. Even globally this doesn't exist.
It doesn't exist. I think dependence among the elderly people is also considered as a stigma. They don't like to be dependent on their family members or their children or their grandchildren. So I think there should be some orientation about this fact that if you are dependent, that's okay. Like, you know, it's okay to be dependent. It's okay to seek for help within the family or outside family. So how can we, you know, make them aware about these small changes? How can we observe if somebody is living with dementia? How can they look in themselves whether they're experiencing something unusual?
Yeah, that's a really, really important aspect, and I'm so glad that you mentioned that, because there's two aspects to dependency in the elderly. And I would say it's okay to say that I want to depend upon my family members so that they can help me remain functional.
Right. Because
as you age, there's natural change in your physical capabilities, and it's okay to get support of family members. Having said that, it's important that we create this awareness amongst family members that if they experience a problem, that seeking medical help doesn't mean they're becoming a burden on their family.
Yeah, right.
So that's one distinction that we need to raise more awareness about.
Now that we are living in nuclear families where most of the children are living either abroad or in metro cities, parents are often left alone.
Yeah.
So it is more challenging for them to take care of them and even to realize that they are living with dementia. They usually name it that it is only because of the old age, and it is a factor which everybody experiences. So awareness is the key. And unfortunately, in India, we don't have that much of awareness. For the first time, I heard about these names were in the two English movies, The Notebook and 50 First Dates. And I just knew about them, and I came to know that, okay, this can be a possibility as well. But after that, I have never heard any government organizing any awareness camp or any hospital taking the initiative to sort of bring this awareness among the masses. So why do you think, why are we lacking behind in it?
That's a really important thing that you've noticed, and I think that there are changes. They're slowly coming in. I think one of the things that I personally feel is that whenever I've spoken to somebody about dementia, unless they've had a personal experience with it, they like to think it's somebody else's problem.
Yeah, right.
So I feel that people think that it's just 8.8 million people. That's a small number considering India's large population.
Right.
We have infectious disease to deal with. We have other major issues and challenges to deal with. A lot of emphasis was given on child and maternal health,
right.
which is fantastic. We've seen huge strides in that. But we're not realizing that we are an aging population. And unless we deal with this today, today is the time to deal with the problem of tomorrow.
Right, right.
When we say that everyone is at risk for dementia, that includes you and me.
Yeah, right.
And if we don't do something about it today, that's going to be the problem. So I think people look at it as being a problem out there.
Okay. So is dementia or Alzheimer's gender specific? Like, what's the percentage like? Males are having it more or the females are having it more? Is there any study about it?
So more women are impacted with dementia, and there's a couple of reasons underlying this. One is that the longevity of women is more. So the greatest, the biggest risk factor for dementia is increase in age. You can't do anything about that. Women tend to live longer than men.
Right.
The other factor is the changes in the hormones post-menopause.
Right.
Our research is showing that this can also have an impact on brain health of women and then lead to dementia. So there's a lot of research which is now going on in that, and it's coming into the purview of how we can support women's health in mid and later life.
Okay. Women are naturally caregivers, so it becomes all the more difficult because when you have been giving all your life, it becomes very difficult to seek help.
Yeah.
You know, at that age where you actually require help. So, just 4 things what government or we as an organization, we have adopted 5 villages, so we can create awareness camps for what are the 5 things we can tell them as a precaution or some supplements that they need to have, because you mentioned the deficiency of vitamin B12. It was very astonishing because most of us are deficient in vitamin B12, and so what are the 5 things or 4 or 5 things that we can tell people to create awareness?
So at a basic, anything that's good for your heart is good for your brain. Particularly for women, since you're asking, and they've always been given. So taking care of yourself is very important. Sleep. Adequate sleep is really important. The brain rejuvenates itself when you sleep, so rest is really important. The second thing is good nutrition and diet. So healthy diet is very critical. Ensure that all the food groups are contained. It's important for families and women to particularly focus on their diet. A lot of women don't, they'll be busy feeding the family, particularly in the older age, but let's feed the children. They don't focus on their own diet. So I think creating that awareness amongst the older women as well as the younger women in the household, that diet is important for everyone in the family is very important.
In India, we don't even have the right plating system. We eat whatever we are getting. There's lack of protein, there is increase of carbohydrates, then we have so many other things we are lacking in. I think that is also very important. We need to know that what to eat, how healthy fats are important, how they are important even to reduce weight, how sleep is very important to actually help your body to recover. So these things are not talked about, but they are very, very important for heart health, for mental health, and for dementia and Alzheimer as well.
Absolutely. And I think, the solutions or the things that can help you reduce your risk factors are good for your overall health anyways. But it's critically important because the brain is the central organ. And when it comes to eating healthy, ensure that there's adequate protein. We tend to ignore that a lot, particularly in the tier 3 cities, in the rural areas. Unfortunately, the access and affordability becomes a question. But intake of proteins, your fruits, vegetables, carbohydrates, fats, all of this is good. And it doesn't have to be fancy food. Local produce, whatever is available locally,
whatever
the
is
seasonal produce is important. So it doesn't mean you have to go for supplements. A regular healthy diet is what is important.
Thank you, Dr. Jayashree. You have given your time to us, and I'm sure with your expertise and valuable insights, our audience have benefited a lot. This is a topic which most of us ignore. This is a fancy term I think most of us have no idea about. So thank you for sharing your expertise and your wisdom with us. I'm sure our audience will learn more about it, and they will create awareness about it. Thank you so much.
Thank you so much, Sakshi.
That's all for today's episode. This is Sakshi Kaushik signing off. Till we meet again, stay healthy and stay happy.